Welcome back to Healthwise. With us, Dr. Carl Gonsolin, a pediatric dentist. Dr. Gonsolin, I guess first of all, as always, we need to stress how important is dentistry, especially for kids, for pediatrics, because a lot of people think that, you don't have to worry about that till you get to be an adult.
Well, baby teeth are extremely important, and dental health for children is extremely important. It's the most common disease in children, and it can be very easily, the vast majority of it can be very easily prevented, and usually it's caused by the parents not knowing that it can happen as early as it does, and what to do to prevent it, and how simple it is to prevent it. So we certainly encourage the prevention of dental problems for children.
Okay. Well, what are some of the things that cause dental problems in kids? Why, because a lot of people would say, well, there's not that many teeth. They're just getting teeth. Why should they have, they're brand new. Why should they have dental problems?
Well, children at a very young age can get cavities very, very quickly. We've seen 18-month-olds, 24-month-olds, 2.5-year-olds come in with very serious dental cavities. Cavities so bad that we either had to extract the teeth because they were abscessed, or they had crowns, root canals, and things like this. And this is caused mostly by the child is put to bed at night with a bottle that contains milk or juice or formula, anything but plain water. We're not worried about the bottle so much as we're worried about what's in the bottle. Or at a sleeping time when the bottle stays in the mouth, or the milk stays in the mouth for such long time. Or they're walking around all day long with a bottle with juice or formula or something like that. And it just keeps the teeth bathed with food, and the bacteria can cause cavities very, very quickly. And the insidious part about it is that it forms on the backside of the front teeth. And so the parents don't notice the problem until it's very big, until it's all the way eaten through the front, the whole tooth. Mm-hmm. And by that time, it's a very, very big cavity. So the parents need to know that, first of all, they can get cavities at a very young age. They should see their dentist for their first checkup before age 1, before the teeth have an opportunity to get the problems. The average child gets his first tooth around 9 months of age. Well, that's still 3 or 4 months before that the teeth can start getting problems. It doesn't take very long for them to get a lot of problems very quickly. At 18 months, 2 years old, that's not a very long time for those teeth to get that badly decayed. And so they need to know that, get that information early, how to take care of the problems before they occur. And you can prevent the vast majority of these problems before they ever happen.
Okay. Doc, as far as pediatrics, when a kid gets a cavity and you have to, hopefully you don't have to extract the tooth, but being that these are baby teeth, is it more of a problem? Because I know those teeth aren't permanent, so what do you do? I mean, and I guess what I'm asking is, what do you do to help it along? I mean, because I don't even know exactly how long a tooth actually is supposed. Well, let's answer that question. Okay. How long do your non-permanent teeth stay?
Well, the first baby tooth isn't lost till about age 5.5 or 6.
Okay.
But the last one might be lost till age 13 or 14.
Wow.
Sometime a lot earlier, but the average is around 13 or so for the last baby tooth. So those teeth are going to be in the mouth for a long time, and they're there for a lot of important reasons. Even though they're baby teeth and they will be lost, they have a function. Otherwise, we wouldn't have them in the first place. And so they're important. The child has to be able to eat well. He has to chew his food properly so he can stay healthy. He has to speak, and the teeth help speaking. Okay. He has to have a nice smile if he's embarrassed. The older they get,
self-esteem, right?
For self-esteem. And of course, an abscessed tooth can get to be very serious. A toothache can be hurt a lot, and it can be a very serious problem and a health-threatening problem with an abscessed tooth. So we don't want to take any chances with that, especially when that can be prevented.
Right. Okay. First of all, too, I know a lot of people wonder, because there's always this apprehension about the dentist hurt. Oh, it's going to hurt going to the dentist. Mm-hmm. What do y'all do to alleviate the kids' fear of going to the dentist? Well,
first of all, as a pediatric dentist, we specialize in children. Our offices cater to children. That doesn't mean that adult dentists can't and shouldn't treat children. I mean, if an adult dentist likes kids and wants to work with kids, he should do that. okay? And if he has the skills to do that, and many of them can and should, okay? And we're the pediatric dentists. We're here to take care of all the kids, especially the kids that are more difficult than the adult dentist feels he can handle. And the first thing is you want to make an environment a pleasant environment. The next thing is you want to make sure you're not doing things that are going to be hurting the child.
Right.
Okay. And of course, if you can prevent the problems before they happen, he doesn't have a bunch of cavities or doesn't have cavities to be fixed, it's a whole lot easier to have teeth clean and have a good time that way. A lot of dentists, when they were going to work on children, they want to use drugs to sedate the child or use gas to sedate the child. We don't like to do that in our office. We don't feel that's necessary. We feel that if you take your time and work with the children, make sure you're not hurting them, okay, that they can put up with it. They don't have to like it, but they can put up with it. I don't expect anybody to like to get their teeth fixed, you know. But if it's not hurting, you're willing to put up with the discomfort or the inconvenience of getting it done to save your teeth. But if you have to make sure you're taking care of the child correctly. You have to explain to him what's going on in a way that he can understand. But you have to follow up with making it as comfortable as possible, you know. And we're not saying it's going to be totally painless, but if they're going to feel a mosquito bite and they know it's going to be about like a mosquito bite and they're prepared for it, it's not going to be a big surprise and it's not going to freak them out, you know. And so you kind of let them know what's going on, let them know what they can do to make the situation better.
Be honest with them, in other words, what you're saying.
Yeah.
Tell them.
Tell them in a way that they can understand, okay, and that they can accept, but you also have to follow up through by doing a good job and not hurting them.
Okay. Well, Doc, when we come back from this brief message with our sponsors, we'll talk a little bit about some of the things you do, you know, in your office. What do y'all offer? And also, I want to talk to you a little bit also about, because now everything you see on TV is the whitening. We want to talk about, is that good for kids as far as pediatrics? Thank you.